Okay, so how do you get your partner treated for a sexually transmitted infection when you come back positive after getting tested? We're going to speak specifically about the two conditions, gonorrhea and chlamydia, both in terms of how common they are and in terms of the availability of something called expedited partner therapy. There are some good options that actually exist, okay? So we're going to talk a little bit about what expedited partner therapy actually is, what it's useful for, some of the limitations that exist, and how you can try and make this happen. First of all, here in the United States, this is a ability for your physician, without actually physically seeing your sexual partner, can provide you medication prescribed to them. Sometimes they'll give it to you in a bag with their name prescribed to it. Sometimes they'll send the prescription to the pharmacy, and they will allow you to get your partner treated without forcing them to come in. The theory on this being that if we can at least lower the bar to access to treatment, the odds that you and both your partner will get their infections cared for and not risk exposing other people to infections, that gets much better. And so we treat more people by lowering the bar and making it easier to access treatment. Now, there are some limitations that exist to this. First of all, the recommended treatment for chlamydia is pills. So that's an actually very easy thing. In some places where they dispense from their office, they can literally give you another bag with your partner's name on it. In places where they require pharmacy, they can just send the prescription in and your partner can go to the pharmacy and get that picked up. There is a slightly different debate over gonorrhea treatment, because gonorrhea treatment, the gold standard first line treatment, is actually an injection, a one-time injection. And that's not the type of thing, we're not going to send you home with a needle to allow your partner to inject themselves. So what do we do there? I think there part of the deal is just communication with your partner. If your partner's able to come into the clinic and your doctor does that, they can come in and get the treatment, and that's good. In cases where they don't or refuse, there is backup treatments, alternative regimens that are generally considered acceptable, but are not considered as reliable as the injection. And those can often be given in the spirit of, hey, this is the best option that we have because we can't get your partner into the office, and this is the best way to make sure that everyone has a chance of being treated to reduce infection and exposure to other people. Now, right now, currently, the CDC only recommends treatment for heterosexual couples. And there is a whole debate about that in the medical universe. I've got a video coming out about that, and I'll go ahead and link that below. And that's something that we need to kind of work through as a society and figure out our answer. But just understand that if you got a sexually transmitted infection, it is by nature and by logic true that somebody else has that infection. And therefore, if you're going to be continuing to be active with that person, it's important to communicate with them, get them treated so you don't just keep getting the same infection back and forth, and to help them reduce risk of exposing other people. I have had conversations with people who did not want to tell their partner because they were angry at them. And one of the conversations that we had was, don't necessarily think about that one person that you might be upset with. Maybe they don't even know. But think about the possibility of the other people in the world that might be exposed, and just try and do the appropriate thing in terms of trying to get everyone the medical care that they need. And sometimes communication is the only way to do that. So please talk to your physician about expedited partner therapy if you come back positive for gonorrhea or chlamydia, because depending on what state you live in, and I'll put links to the legalities of that below, there are often options to help you get your partner treated with a lower bar to access.